2 weeks ago, a woman sat in my clinic clutching a piece of paper. Let's call her Patricia. She was 64, a retired head teacher. The paper was a CT scan report. One word on it had changed her entire life: pulmonary fibrosis. She looked at me and said, "Dr. Paul, I went home, I typed it into Google, and I read that I have 2 to 3 years left. I haven't slept since." And I had to tell her the truth. Not the truth she was terrified of, the truth almost nobody had bothered to explain to her. Because what Patricia did in the days after her diagnosis, the panic, the Googling, the silent bargaining, that is the exact opposite of what actually gives patients the best outcome. There are 5 things you need to do first. And if you get the first one wrong, everything after it gets harder. I am Dr. Suman Paul, a consultant respiratory physician working in the NHS and private practice here in the UK. In 15 years of treating lung disease, I have sat across from hundreds of patients on the day their world tilted. Quick disclaimer before we go further. I am a doctor, but I'm not your doctor. This is educational only. If you are severely breathless at rest right now, call 999. In this video, I'm going to walk you through all 5 steps in order. But stay with me to step 3 because that's where I see patients miss out on a treatment they were fully entitled to, simply because nobody told them the one question to ask. Here is the first thing, and it is the one that changes everything else. Pulmonary fibrosis is not one disease. It is an umbrella term, like saying car trouble. It tells you something is wrong, but not what. And the treatment for one type is completely different from another. Some fibrosis is idiopathic, meaning we don't know the cause. Some is driven by an autoimmune condition like rheumatoid arthritis. Some comes from exposure to bird, mood, asbestos, certain medications. Some types are stable for years, others progress faster and need urgent treatment. Think of it like this. If a fire is burning in your house, you need to know whether it's an electrical fire or a grease fire before you reach for the water, because using the wrong one makes it worse. So, the single most important step after diagnosis is making sure your exact subtype has been formally confirmed by a specialist interstitial lung disease team, what we call an ILD MDT. This is a panel: respiratory physicians, radiologists, sometimes pathologists, who look at your scan and history together. If you have been given the label pulmonary fibrosis and nobody has told you which type, that is the first conversation you need to have. But once you know your type, there is a second step, and this one surprised even me when I first started practicing. Because most newly diagnosed patients assume the next move is medication. It isn't. What actually protects your lungs first has nothing to do with the prescription at all. Before we talk about any drug, you need to defend the lung function you currently have. And 2 things damage is faster than almost anything else. First is smoking in any form, including secondhand smoke and vaping. I know for some of you this is hard to hear, but every single cigarette accelerates scarring of your lungs. If you still smoke, quitting this week will do more for your prognosis than most medications on the market. Speak to your GP about support. There is more available now than ever. Second, and this is the one people skip: infections. When you have lung fibrosis, a chest infection isn't just a bad week. A serious bout of flu or pneumonia can cause a permanent step down in lung function that never fully recovers. I have watched stable patients lose years of progress after one winter infection. So the flu jab, the pneumococcal vaccine, the COVID vaccine, depending on the current rules, if you are eligible, these are not optional extras anymore. They are frontline lung protection. This is a small, free, boring step that quietly does more than almost anything else on this list. If this is already making things clearer than your last clinic appointment did, that is exactly why I make these videos. Subscribe because I break down complex lung condition in plain English so you can have better conversations with your own medical team. And drop a comment if you have just been diagnosed. I read every single one. Now, here is number three, the step I promised you at the start. This is where I see patients miss out on treatment they were fully entitled to, simply because nobody told them the question to ask. And the window to ask, it is smaller than most people realize. For certain types of progressive pulmonary fibrosis, there are now drugs called antifibrotics. In the UK, the two main ones are pirfenidone and nintedanib. This do not reverse scarring. Let me be honest about that. But what they can do is significantly slow the rate at which your fibrosis progresses. In simple terms, they slow the clock. Here is the problem. Eligibility for these drugs is tied to specific criteria, often based on your lung function test and the type and progression of your fibrosis. And access can depend on being under the right specialist service at the right time. Many patients are never told this exists, or they find out months later after avoidable decline. So the exact question to ask your specialist is this: based on my type of fibrosis and my lung function, am I a candidate for antifibrotic therapy? And if not now, what would need to change for me to become one? Write that down. Bring it to your appointment. That one sentence puts you in a completely different position because it tells your team you understand there is a pathway and you want to be assessed against it. But medication is only part of the picture because there is a fourth thing. And when I tell patients about it, most of them react the exact same way. They assume it's not for them. They think it's too gentle to matter. The research says the complete opposite. Pulmonary rehabilitation. It sounds soft. It sounds like something you do at the end. It is one of the most evidence-backed interventions we have for fibrosis. And it should start early, not as a last resort. Here is why it works. Your lungs do not breathe alone. They depend on a team of muscles, your diaphragm, the muscles between your ribs, your legs carrying you up the stairs. When you become breathless, the natural instinct is to move less. But the less you move, the weaker those muscles get, and the more breathless you become. It is a vicious cycle that tightens every month. Pulmonary rehab breaks that cycle. It is a structured program of supervised exercise and education designed specifically for lung patients. Studies consistently show it improves how far patients can walk, reduces breathlessness, and genuinely improves the quality of life. I had a fibrosis patient, 68 years of age, who thought his walking days were behind him. 12 weeks of rehab later, he told me he had walked his daughter down the aisle without stopping to catch his breath. Not because of a new drug, because he trained the muscles that support his lungs. That brings us to the fifth thing. And honestly, this is the one patients resist the most because it feels emotional rather than medical. Part of everything on the list, it is the one that changes how the entire journey feels, and it starts with a single phone call. Pulmonary fibrosis diagnosis is not something you are meant to manage by yourself quietly at 2 a.m. on YouTube, Google, or ChatGPT. The patients who do best are the ones who build a team around the diagnosis. That means three things. First, make sure you have a named contact at your ILD service. A specialist nurse is often the most valuable person you will ever speak to. Someone you can call when something changes rather than waiting months. And if you are in the northwest of England and want a specialist who has the time to actually sit with you, explain your subtype properly, and answer the questions your NHS appointment didn't have time for, that's exactly what I do in my private clinics in Liverpool, Manchester, and Neutral Willows. The booking link is in the description. Second, involve your family in your appointments. Breathlessness and fear are lighter when they are shared, and a second pair of ear in the room catches what panic makes you miss. And third, connect with others who actually understand. Patient support groups and communities for fibrosis exist precisely because information alone is not enough. You also need people who get it. Patricia, the head teacher, did all five of this. We confirmed her ILD subtype. It turned out to be more stable than that terrifying Google statistics suggested. She stopped relying on fear and started asking the right questions. And the last time I saw her, she told me something I hear far too often. I wish someone had just told me this on day one. So this is the reason I made this video. Because the day of diagnosis should not be the day you are handed a word and left alone with the internet. Let me leave you with this. A pulmonary fibrosis diagnosis is not a full stop. It is a signal to become more precise, more proactive, and more supported about what is happening inside your lungs. Confirm your exact type, protect the lungs you have, ask about antifibrotics, get into pulmonary rehab, and build your team. If you are in the northwest of England and want to discuss lungs directly with me, the booking link is in the description. Please share this video with anyone who has just been diagnosed with pulmonary fibrosis. You could genuinely be the reason they have the conversation their doctor didn't have time for. And check out my video next on the 5 things quietly destroying your lungs after 55. I'm Dr. Suman Paul. Take care of your lungs. They are the only ones you have. See you on the other side.